This conference will now be recorded.
Okay. Hi, I'm Ellen DiPaola. I'm the president and CEO of Honoring Choices Massachusetts, and I'm delighted to be with all of you today to tell you a little bit about what Honoring Choices is doing, offer you some tools and some great handouts and toolkits to be able to start proactive planning conversations at every phase of health. All right, there we go. So Honoring Choices was started about 7 years ago. I'm an attorney by trade, a guardianship attorney, and it was becoming very obvious to me that people didn't understand that they had a basic civil right to be able to say what they wanted for care or know how to reach to very simple planning documents that they could do themselves. So we thought, of course, what if we all just banded together? And we were able to give those tools out for free, not only to the consumer, but to all of you, to all the care providers on the ground who do this work every day. And then try to work together to make sure people get care in their community. And that's our mission. We really have a flag that says your healthcare, your choice. We're trying to get everyone whatever is the best possible care. And lately, it's very important around the timely care when they need it and equitable care. So that's what we do. We inform and empower adults to make a healthcare plan and then to connect to care right in their community. So we have a website. Everything we talk about today is on that website, all the Honoring Choices tools. And we partner with hundreds of organizations and actually thousands now of care providers. One of our wonderful partners is Mass Home Care. Lisa has been incredibly supportive over the years and in bringing, helping me understand the needs of all of you and how we can bring you tools. So we have lots of toolkits, discussion guides. We do webinars. Many of you, I saw a lovely list today of who's on the call, are already individual community partners. So the organization, Mass Home Care, is an alliance partner, so we can do everything through that. But we'd like to know all of you individually as well. You'll see on our website, we have a partner section that says community partners. We break it up into 6 or 7 regions in the state, and then we list you. We can list you individually. What's been really useful, we've heard from consumers, is it really helps them find you within their community. So if you're on the North Shore, the South Shore, Metro West, or in Worcester, we'd love to list you as a community partner. There's nothing more to do other than what we're doing right now. There's no cost or obligation, but it allows us to promote what you're doing locally, and we'd love to do that. All you need to do is send me an email, and we could be a partner. So today we're just going to work on our outline here today. Is I just want to take 5 minutes to update you on what we know the advances are during COVID. Then we'll move right into how to have seamless, proactive planning conversations and how to document those patient choices. We'll go over the 5 planning documents in Massachusetts and would welcome your questions about that. They're not easy. They're not set up in a way that makes it simple. So if you've experienced those roadblocks, they're real. And then we'll show you the Getting Started Toolkit and our Next Steps Toolkit. Again, really easy for you to just pick up and use to start conversations. And we're so fortunate to be working with Ariadne Labs. And today we'd like to introduce their Serious Illness Conversation Guide. And it's just an introduction to it today, but I hope gives you a sense of how to flow seamlessly from a really simple conversation to a more complex conversation. And then we'd welcome everybody's thoughts for implementation and what you need, especially in the next coming months while we go through this next phase of COVID. So here are the updates I just wanted to review. Some may be really familiar to you. Everything about this is on our Plan in Place page, so you can read more there. But we know how telehealth has been so useful, and that's a wonderful thing. We understand that the state is making moves. There's a group called TMED out of the MHA, Massachusetts Health and Hospital Association. TMED has filed some legislation to help extend telehealth. I think it passed the Senate. It's going to move on to the House, and it's a complex bill, but basically we're trying to keep telehealth in play at least until December of 2020. So nothing's final. I just want to alert you to it, and you can read more about that on our website if you like. But the thing we got excited about too is that on a federal level, Medicare started to reimburse our care providers for advanced care planning conversations, 30-minute conversations. And it used to be just physicians, nurse practitioners, physicians assistants. But during COVID, they did two wonderful things. They said you can be reimbursed as nurses, social workers, care managers, and we can use audio only. And that's been a really important development, as you would, I'm sure, imagine, because not everybody has audio visual equipment. And even if you have it, it's difficult to use sometimes. So we're seeing those developments. Again, that's federal money. We're hoping to hear federally that they're going to extend that out into December 2020 as well. If you need more information about that, just send me an email. Witness verbal consent on a MOLST form. I'm not sure how many of you use the MOLST form or are aware of it. MOLST stands for Medical Orders for Life-Sustaining Treatment. And MOLST forms are used with people who are diagnosed with serious illness or are frail adults, or now even high risk for COVID adults, where a patient can have a conversation with their healthcare provider to talk about their current prognosis and diagnosis. Again, they're high risk or they're in that serious illness category with a life-limiting illness, and talk about their prognosis. What happens if I get COVID? What kind of choices do I need to make around end-of-life care? So it's been a very effective form for those people. But when COVID happened and we were all under stay-at-home orders, the MOLST became very hard to do because it required an in-person signature from the patient. So you'd have to be sitting next to your clinician to sign the MOLST form. So Honoring Choices quickly got a group together and we asked the state to lift that barrier. And now we're able to do verbal consent when in-person is not possible to do. And the instructions for how to do that is on the website. Now, that is still only done under the law in Massachusetts by a clinician, a nurse practitioner, or a physician's assistant. But we are working hard here to get that law, that regulation expanded so that nurses, social workers, care managers, anybody who interacts with that population can have their conversations credited in some way towards helping people with end-of-life care decisions. Again, so we're glad about witness verbal consent. It has proved to be a really valuable piece to help people, and hopefully we'll keep it in permanently in Massachusetts. Not yet, still working on it. For those of you who work with guardians, during COVID, we saw a really tough situation where someone had a COVID diagnosis. They just had a couple of days to live. They couldn't, because they were still on a full code, which means they're, as you know, that means that everything was going to be done for them, meaning if their heart and breathing stopped, they would be revived. And if the doctors were saying, look, even if we do that, it's really just causing more harm and suffering because they're going to die from COVID. For people who were incapacitated and under guardianship, the guardians can't make those decisions to change from a full code to a comfort care mode. A family member could do that in a second, usually in a hospital, or certainly a healthcare agent could make that change, in talking with the physician about what was best medically indicated for that person at that time. The guardians can't do that without going back to court for a hearing to get permission from the court to say, here's where my person is, and we need to change from a full code to a comfort code. So then they could just be made comfortable wherever they are, whether that was the hospital or the nursing facility, and allowed to die naturally and with comfort and as much dignity as possible. So that became a problem during COVID. So we went to the court and we said we need to make these hearings happen much quicker, within 24 to 72 hours. And I have to say the court was wonderful about trying very hard, as the court was actually closed during that time period. But this is a change we want to keep in play. So here's what I want to say to you. If you work with folks who are under guardianship, who are seriously ill or in that high-risk category, and you're having difficulty getting those extended hearings, to be able to sign a MOLST form or go to a code status change from full code to comfort care, let me know. We're still working very closely with the court about how to make changes around this to make this a much smoother process. And lastly, I just want to announce that in a couple of weeks, we have Honoring Choices as part of a group with the Mass Coalition for Serious Illness Care and Ariadne Labs to stand up a web portal, so a web link, so that makes it possible for us to talk about serious illness conversations on the phone with someone, and if they want, be able to fill out a MOLST form digitally, right online. And again, this came about because our doctors were saying, you know, we just, our workflow, their workflow was so stuck in COVID. There were so many patients that doing the paperwork was hard. So we thought if we had a web portal where they would just sign in, be able to see what you'll see today, the Serious Illness Conversation Guide tools to go through a serious illness conversation, and then if the patient chose to be able to sign and go through the choices in a MOLST form. And the state gave us special permission just for this web portal that patients and doctors can sign digitally. It's actually very interesting. They take a finger and they sign their name and it shows up on a MOLST form. Here's the good news about this. Working in teams now, if you are working with a physician, a nurse practitioner, or a physician's assistant, those three folks can sign a valid MOLST form. And usually they've been the three folks who could only talk about this. But we definitely want to now make this a team-based experience. So if you're working in a team with those folks and you're working towards MOLST forms, you too will be able to sign on to this web portal and start these conversations. Happy to tell you more about it. Again, it's on the website. We're excited that it may give our team members a way to have these credited conversations and have them be documented with the people that they work with. Everything about this is in the Plan in Place page. So even if you just go to the website, you'll see right on top a Plan in Place page. We created that for COVID. So I'm going to stop for a second and ask Molly and Lisa and all of you, do you have thoughts or questions about any of this? Have you experienced this during COVID? And have there been barriers that we can help you work with around these pieces?
Ellen, I don't see anything in the chat box, just so you know. I'm just letting you.
Anybody have a question? Just open up your mic, I suppose, right? All right, terrific.
Yeah, if you want to ask a live question, again, just remember, sorry, if you want to ask a live question at any point, on the left-hand side, there's a little microphone, and it should be red, and you just click it on it, and it will be green. So thank you.
Okay, great. I hope that's useful information for you. We hope to keep knocking down those barriers as we go forward. Again, one of the blessings of this last couple of months is that it shined a light on a lot of our gaps and a lot of our barriers, and with a lot of teamwork and I think cooperation and amazing leadership actually from the state and the court, we were able to remove some of those barriers, but we want to keep making them more permanent for folks as we go. Okay, so let's get to the meat of what we're doing today, how to have proactive planning discussions. We have a model for you here to have seamless discussions. This is our mission. This is our mission, that everybody makes a plan so that they're able to get the best possible care right through their lifetime, while we're promoting everyday wellness, while we're managing chronic illness and living with serious illness. That's the goal of Honoring Choices. It doesn't center on just care at the end of your life, but we center on how to get good care all through your life. And our new normal, as I said now, as you know, is talking with a lot of high-risk folks, seriously ill and frail patients. So in that light, how do we start these simple conversations and move into a more complex conversation about what matters most, especially towards if you get in a situation where you're going to need to make decisions about end-of-life care. And how do we use these 5 Massachusetts planning documents? So some of this today will be very familiar to you, but we want to just give you a sense of how to quickly add things to your desktop, to your files, to say, here's where the document is that I need. Here's where the discussion guide is that would help with this particular client. So we always start in the same place, no matter where people are. We have found this with our hundreds of partners that this is such a successful sentence. We'll talk more about it, but you can always start with, do you have a healthcare agent? And then we're offering you the Getting Started Toolkit. That's the Honoring Choices kit. It has 2 documents in it, a free healthcare proxy, it's an Honoring Choices healthcare proxy, and the personal directive, which is a living will. In the Next Step Toolkit, you'll see information about the Durable Power of Attorney, which is that 3rd document, a Comfort Care Do Not Resuscitate Order. You know, what is that? And that's still a very valid form in Massachusetts. And the MOLST form, the medical orders for life-sustaining treatment. Now, what we have in that toolkit is information about these and where to find them. The Getting Started Toolkit actually offers you unique documents for the healthcare proxy and the personal directive. You're very free to use, download and use. And then today, as I said, we'll introduce you to the Serious Illness Conversation Guide to talk about what matters most. They have a regular guide, and they actually have a COVID-19 guide that really is very helpful in terms of directing questions about COVID-19. So Honoring Choices is all about everybody making a healthcare plan, and we know that it's just never been more important to do this. One of our palliative care partners, Dr. Elizabeth Collins at Leahy Health, said to me the other day, it's just she wants to mandate that nobody ever leaves a primary care office, a primary physician's office, or a televisit without the question, do you have a proxy? It just became so important in the hospital to have that on file. That is the one document, if people can pick an agent, that actually protects them. It protects their rights for the doctors to say, wait a minute, here's a proxy, we need to call this agent before we here make decisions about care. And of course, we know how much it supports families just to be able to have conversations with folks about what someone in their family wants for care. And it really helps those care providers. They tell me over and over again, the hospital physicians especially, that they can't read minds. They only have seconds, sometimes minutes, hours, to help understand what somebody wants for care and then to offer that to them. So at Honoring Choices, what we did was we said, let's make this free and easy. So we can make your own plan, and the goal is to get that care. We have a structured approach to healthcare planning. It's very simple. It's what we want both consumers and care providers to use. So we're using that same language and we're using the same tools. And basically our model is simple. It's like, let's start with, before we pick up a document, let's start by saying, you know, where are you on that journey? What's right for you? What kind of choices do you want to make about who's your agent and what kind of care you want? And then when you're ready, then let's pick up those documents and start to write down those choices. And when we're making this plan, to remember, this isn't about some future decision about my end of life. It really is about how you're feeling today. What kind of goals of care can we create with your healthcare providers to help you stay healthy and help you manage that chronic illness, as well as get the best end of life care? So that's our model. We have a Who's Your Agent program, tried to make this simple. It has 2 toolkits, Getting Started and Next Steps, and we're just trying to open the door to these lifelong healthcare planning discussions so that they really become routine. The earlier we do this, the more we can build on those conversations, and it's okay that they change. They're supposed to change over your lifetime, and that becomes something that becomes more normal. So here's how the tools break down for those of you who haven't seen the toolkits yet. As I said, the Getting Started has original Honoring Choices documents in many languages for the healthcare proxy and the personal directive, and then the Next Steps toolkit has the 3 we talked about. That's where you find the documents. Now today, for those of you who'd like to, this webinar includes you becoming a healthcare planning ambassador. What we learned is that when we have so many people across the state using the Getting Started toolkit and it's been embedded into hospitals and nursing facilities, assisted living, primary care. It's just in a lot of places. But we wanted to say that the people who know how to use that kit have some expertise. They have some tools. They actually have become the in-house experts because there's so many misconceptions about the basic healthcare proxy. So we made them, actually it was a social worker's idea, said, don't you have some kind of certificate for this so that I can go and say to people, I know what I'm talking about? So I said, okay, sure. Let's make everyone healthcare planning ambassadors. So we give you a certificate, and you just know that you can use this kit with your people where you are for person-to-person discussions. At the end of this, you can decide whether to become an ambassador or not. We'd love to have all of you be ambassadors. So, the more we can stabilize this language and give people the right information, the better we're all going to be. So the kit is really easy, and this is a handout that you have. It's a 1, 2, 3. It's if you can, choose a healthcare agent in a proxy. And then we want people to talk with their families or whoever's important to them about their choices. Write the choices down. The agent only appoints a person and gives that person authority to make decisions. But the personal directive says, here's what I want. Here are my instructions. Really important to have both documents. And then the third is we have some discussion guides to make it easy for people to talk to their care providers about the goals of care. And again, to try to get good care right now, today. That's the kit. So one of the things that makes this easy is Massachusetts law actually, as I say, makes it easy. It says in the law that the person you choose is actually called your healthcare agent. That's the person, your agent, and that's the basis of our program. And that the document is the proxy, right in our law. So that part of our program is, I was so happy to read that a couple of years ago or many years ago because it made so much sense to me. I want to talk about the agent. I don't really want to talk about the document. I want to say, who's your agent? Who's your person? Who's your advocate? Do you have one? Have you told them a little bit about you and what your choices are? So we get to talk about the person instead of the document. The document itself is really important because it just makes legal who the agent is. But we can. I wanted to let you know that that's really what helps. We have our partners have told us over and over again that actually in step 1, how to choose an agent, just start with this question. Do you have a healthcare agent? We know that when we say, do you have a proxy, it sometimes goes over people's heads. They've been asked so many times in so many different places. They may not even know what it means, what a proxy is. It's a legal term. But if we start, we find with saying, do you have an agent? It takes people a bit by surprise. And it gives you the opportunity to say, let me tell you what an agent is. That's a person you choose. That's a person you trust to be able to make decisions for you if you can't do it for yourself. If you get sick, even for a short while, that agent can step in and has the power to talk to your doctors to get you the care that you need. It's a really powerful position, the agent. And when people understand that we're appointing, it's someone I trust, I think the power dynamic switches on these conversations. Instead of saying, do you just have a document? Do you have a person? And you get to talk about that. And you also get to explore who can be an agent. Anyone who's over 18 really can be an agent, except a doctor or someone who's in that person's care. That would be a conflict of interest. But you can explore that. Now, in the toolkit, the Getting Started toolkit, we go into this more in depth about who can be an agent. We give you handouts that you can give to your person or just have yourself. All the information you need about this is in the kit. If it's not in the kit, you don't need to know it. Sometimes what happens is people will have bigger medical questions, bigger legal questions. If it's not covered in that kit, then you need to go outside to get those answers. So just by starting with, do you have an agent? The partners have found it's incredibly useful. It can be as much as a 3 to 5 minute conversation. That's it, especially if someone knows who to choose. I want to point out that in Massachusetts, we must appoint in this state. We don't have a default surrogate law, which means if I can't speak, then my family gets to speak for me. That does happen in the hospitals, but generally under the law, your spouse or your family member doesn't automatically have the legal power to make decisions for you unless they're in that healthcare proxy. So I'm sure you've run into this situation where someone may be quite sick, can't speak for themselves, right? So, and now we have family who are trying to make decisions for that person. If no one is appointed as an agent, all those family members have equal power about making decisions. Just because you're a spouse or a mother or doesn't automatically mean you get the power. And that's where we have the conflicts. That's why it's just so important to appoint an agent if you can, especially in the time of COVID now, where time is of the essence, and having a legally appointed agent means our physicians need to call that person and say, come on in, give us, or to get us on the phone, tell us what you know about this person, what kind of care what they would have wanted. So that's how you start. Do you have an agent? Honoring Choices has a healthcare proxy. I don't know if you've seen it. It's all free and downloadable. We have it in 10 languages. Take a look at that. If you're working with folks where we need additional languages, just email me. Tell me what it is. We know that throughout the state there are communities of folks, and it's easier, much easier, if we're able to offer them a proxy in their language. You can do this with someone in a few minutes. We don't need lawyers to do this. Before you start with a person, what you're just going to need is the healthcare agent's name, so who the person is going to pick, and those phone numbers. You'll see that in number 2. If they can pick an alternate healthcare agent, it's wonderful. Sometimes the first agent is not, the primary agent is just not available. So the alternate just would step up to be able to help make those decisions. But I want to tell you that we learned that a lot of our seniors weren't doing this form because they couldn't pick 2 people. They could barely pick one person to be an agent. So you know what? If you don't have an alternate, it's perfectly fine. You don't need it to make this form valid. Okay? You can also go back and at some point and add that alternate at some later time. And then in number 4, we just want to run down this proxy. This is where you just give your healthcare agent the authority to make decisions. So you're basically saying, I give my agent any and all ability to make decisions with my doctor as things come up, unless I want to limit that agent's power. For some reason, if you want to say, I don't want my agent to have this particular power, you write it right there in the proxy. And then in number 5, you sign and date it, but you must do that in front of 2 witnesses. So this is the tricky part, especially this was really tricky in COVID, was you need to sign this in the presence of 2 witnesses. The witnesses can be anybody except the healthcare agent and the alternate agent. So you can imagine witnesses are people in the next cubicle, they're people down the street, they're whoever can witness a signature. So the person signs and the witnesses sign each 1 and 2. So with this healthcare proxy, you also will download an instructions form that mirrors this and brings you through this step by step. So it's very easy for people to do. Once you have those signatures, you have a valid legal healthcare proxy. You can make as many copies as you want. The copies are as good as the originals, and make sure people, you give them out to the agent to get them in the medical record, and people can do whatever they want with this. This is their proxy. They can change it every day if they want to. But we want to make sure it gets in the hands of people who can then actualize it. So the question often comes in Massachusetts, what if I'm not able to choose a healthcare agent? And our partners now, since we've been doing this for 7 years, I think have figured out about 1/3 of the people that they speak to just can't name a healthcare agent. And the interesting thing is it's people of all ages and all walks of life. So what we like to say as ambassadors, and this is where the ambassadors are just really shining, saying, you know what, it's okay. You don't have an agent, no problem. Let's just make sure we're letting people know what you want for care. And you can do that in a personal directive. So for the folks who can't choose agents, as healthcare ambassadors, you can be incredibly helpful in getting them just starting with this next step, with step 2 in the guide. So step 2 in the Getting Started Toolkit focuses on the personal directive. Now, what's a personal directive? It's actually anything in the state that's called a living will. There's lots of different types of living wills. But we named it a personal directive just to make the point that this is personal, it's not a legal document, and it's my directive. It's what I want for care. So what we tell folks, it seems to help, is to say it's like a personal letter to your agent, to your family, to your friends, whoever it is, it's yours. You can do whatever you want with it. You write down what's important to you, you give some instructions for the care you want. You know, it's not only medical instructions, but it's also personal. We find that this has been really useful for folks to say, you know, if I'm sick for a few days, I need someone to take care of the cat. I need someone to take care of the person downstairs who I watch over. And we find that it's really important to have people feel like they can give those instructions just so that they can go to the hospital or wherever they're going to get better. So clinicians are using the personal directive to really understand what people want and to align those care goals with the care they're going to get. But understand that in most states, they have a living will law that binds the doctors to these decisions. In Massachusetts, we don't have that law, so that the personal directive is really just a personal statement. But the way the general law works in Massachusetts is if your physicians know what you want for care, if they're able to see it in a personal directive, then they should offer you that care. It's also a great way, we found, our partners have told us this, to actually start a discussion with a family or people that are important to you. We've heard back from our bilingual ambassadors that families, Russian and Hispanic, Portuguese, and Vietnamese, I believe, have different ideas about how this should work for their family and seem to prefer to start with the personal directive than the healthcare proxy. Instead of choosing one person, if we're not in a crisis situation, we heard this from our Russian ambassadors particularly, that if we're not in crisis, it's much easier to start a discussion about, you know, if you get sick, what's going to happen? What do you want your family to do? And that's where they can write that down in the personal directive. So try it out. Let us know what you think. All our information comes from our partners here to make our tools better. So here's what the personal directive looks like. Right now we have it translated in sorry, you can download it in 4 languages, right? It's an easy 2-page document. The first page is really just about personal preferences. Now, people can fill this out as much as they want or skip things, but we're trying to get a sense of what's most important to that person. What do they want if they get ill? And they're going to recover, but what would they want to tell others about what they want for care? Are there cultural, religious, spiritual values you want to make people aware of? What worries people most? And this is a really interesting question because it may not be medical. It may be something personal that is really worrying them about being sick, especially now with COVID looming. And then if you are in that serious illness category and you're not expected to recover, you know, what would you want with your care? So those just start out with some questions. It also includes people to inform about my choices. Again, you may have an agent or you may not here, but you may have a close friend. You may rely on your clergy or someone at your council on aging who can help. And the second page, I'm sorry, this is still the first page. I seem to have a double here. So that's that first page. And the second page goes right to the medical care decisions and treatment preferences. So we found with folks this idea about what's my current medical condition, they actually know it better than anybody. what medications work, what facilities they've been to. If they have treatment preferences, it really helps. Then B talks about life-sustaining treatments. We find especially our seniors who are basically healthy have been um, very empowered to be able to say, look, I can't fill out a MOLST form yet because I'm not seriously ill. I'm just working through and managing my illness, but I want to write down what I want in case something happens to me unexpected tomorrow. So they can use this. They can use those choices, put any other information you want on this, you sign and date the document. Again, you don't need witnesses here, not a legal document, but really works well going hand in hand with the healthcare proxy. So in just summation about this part, and then we'll stop for questions, but really simple. If you can choose an agent, excellent. Do both documents. You need to be able to pick somebody in the healthcare proxy, right? And then in the personal directive, tell that agent what's important to you and what you want for care. Imagine how much ground you're covering just by able to do those two documents. And if you don't have an agent, it's been so wonderfully empowering for our ambassadors to say, it's okay. A lot of people don't. Don't worry about it. But let's make sure we're writing down what you want in a personal directive. And I'll just go over step 3 and then we'll stop. But the step 3 in the getting started toolkit is just really about, now that you've done some making choices, you've written down what you wanted for care, let's get those documents to our doctors and let's make sure we're talking about goals of care. How are you feeling today? What kind of goals do you have right now? How can we work on that? And to talk about what's ahead for me, we have found, as I'm sure you've heard this many times from seniors, is they're worried about the future, especially now. Stakes went up. How can we help them be less worried? And that's what these proactive conversations are about. Just being able to help relieve some of the stress that's going on out there in terms of what's going to happen to me. I'll just stop and tell you, when COVID first started, one of our partners is Bay State Health out in Springfield, very large population of people that they serve. They immediately, the social workers there and the nurses made lists of their high risk patients and said, let's call them. So within the first week or two, when it got serious, they called over 500 people. And basically they were a little worried about, is this going to be intrusive if I make this phone call, to try to have a proactive planning conversation, to say, how are you doing? Do you have a healthcare proxy? Should we check to see if it's valid? But what they found is that people so welcomed the conversation. They were just sitting there scared. And that the phone calls not only helped people to feel more balanced, get a few questions answered. If they needed care, the nurses and the social workers connected them to the care, but they also did a lot of healthcare proxies on the phone, made people feel really good. So that seems to have worked well. That was one of the many groups that did those proactive conversations during the beginnings of COVID and seemed to really work well. So we have for you in this kit a consumer guide to start a discussion. We call it 5 things to talk about with your care providers. And you can start with any question, anywhere people feel like they are, and use whatever works. It's funny that that very first question, I'd like to understand more about my health or my illness, that's the big question that seems to open the door. People tell us they don't have enough information, or sometimes it's just confusing. And being able to talk about where they are in their illness, what's ahead for them, seems to open the door to a lot of these questions. Like, I want to discuss the care that I want. Let me tell you what's important to me, my personal values and goals here, what worries me most. And let's make a plan. Let's write it down. And the purpose of all of this, of course, is to know people's choices, make sure it's in the medical record, and then to be able to honor those choices. Make sure your care providers are going to be able to know your choices. That question there under number 5, it said, in an emergency, if I can't speak with you, how will I know my choices will be followed? We heard a lot of concern about that, about going to the ED, going to the emergency department, and how will we know our documents are going to be there? So it's something we can work through with folks. So that's the discussion guide. We have a lot of discussion guides built on this. This is just a beginning one. We also have one for you, for our care providers. You can start these discussions as well. Pick and choose. You know, you can add to your script however you do this successfully with a lot of these questions. And then if you can, this is another issue for people. You know, they do these documents, but we can't get them into the medical record. So if you have a way to help people make a copy of things, make sure it gets to their primary care physician, that's terrific. And then also make sure they're giving a copy to their agent and anybody else they want to. Remember, we said make as many copies as you want. Okay, so I'm going to stop before we go to the next steps toolkit. And I just want to see if there are questions about the Getting Started toolkit. If you feel like you can easily take that and implement it. I'll just wait and see. Any questions on chat? Anybody have a question?
We don't have anything in the chat, but
okay. Yeah, I'm just really curious about if people are making phone calls, doing proactive conversations. Please let me know if you've done that, how it's been going. Okay, I'll keep moving as you think about it, but please let me know. You know, it's so helpful to us to know where the barriers are for you. This is all well and good on paper, but how does it work for you is really the important piece for us. So that next steps toolkit really just builds on the Getting Started. We want to make sure people understand that even if they do a healthcare proxy and a personal directive, they can change it. As long as they're competent, they have the ability to make effective decisions, they can change these documents. Those documents belong to them, not to the hospital, not to the nursing or long-term care facilities, to the consumer. And so this next toolkit just builds on some of those discussions and may be also something useful to you for the people you're working with. So we have more discussion guides that are geared towards managing chronic illness and living with serious illness. The questions just change a little bit, but meaningfully. And then we want to build that plan. So if we go back and remember what we first started with, there are 5 planning documents in Massachusetts. There they are again. You don't have to use all of them. We certainly recommend people do a proxy, do the personal directive or a living will. And then the durable power of attorney is an important document for, as you know, it's a legal document where you choose, I would choose a person to make financial decisions for me. And if I become sick tomorrow and can't manage my bank accounts, my estate, I can't pay my rent, I've chosen a person I trust to be able to do that work. So we're offering those powers of attorney to someone else. We do recommend that gets done with a lawyer, although if you have a very simple estate, you can use the documents that are online. But you know, I tell you, I just this is where lawyers do well. If you can ask them just to do this document, don't want to do a full estate plan, maybe some other time, but can you do a simple document for one of my people, one of my clients, or one of my consumers to help them understand that you know, if they get sick, there's somebody watching out for their estate and their money. And then those last 2 documents are medical documents, the MOLST form and the CCDNR form. And we only do those if we're seriously ill, if we're at risk. Otherwise, you may never do those 2 forms. You'll see on the website, the Next Step Toolkit also has information about palliative care. I'm not sure how much that comes up for you, but we are, as we move into redefining serious illness care in Massachusetts, which Honoring Choices is doing with many of its partners, we want to make sure everyone has access to palliative care. Really simple, it's just this wonderful thing, right? It's a team of people who come and get assembled and are able to help somebody with a serious illness, whether that's a 5-year-old with a leukemia diagnosis, or a 35-year-old with COVID, or someone who's got a cancer diagnosis and at the end of life. Palliative care is just that extra layer of support from other doctors, nurses, pharmacy, chaplain folks that assemble to help the patient and also help the family. There's more on it on our website. And certainly come and look at hospice care as well. So that toolkit, as you see, is pretty expansive. But really what it is a lot of resources for you on the website. Any questions?
We did have a couple of questions in the chat box.
Sure.
So the first one was, can you clarify incompetent versus the need to invoke the healthcare proxy, as once it is invoked, the PCP will not support a change in the healthcare proxy agent, will not uninvoke it if another PCP invoked it. Did I say?
Okay, I'm not sure I got that all. So that, just lead me through it. If you have someone who's incapacitated, right? And the only way that happens, by the way, under the law, is that a physician, it has to be a medical determination, right? That a physician says the patient, we'll call it the patient, is not able to make safe medical decisions anymore. And it's supposed to be written in the medical record. Okay, so if you ever have questions about how healthcare proxies stepped up, ask about that. Say, was there a medical determination? Is it written in the medical record? Because that's your first safety bar. Now, Molly, maybe you can help me with the next part, which is that once that agent is now invoked to make decisions.
Yes, then the PCP will not support a change in the agent, and will not uninvoke it if another PCP invoked it. So
Yeah,
I imagine it's two, if there's two doctors involved.
Right, two doctors, and one is not wanting to challenge the first one. Is that what I'm getting?
Yeah, I don't know. This question was from Donna. I don't know if Donna wants to.
Yeah, and I might need to talk to this person offline, because this is what happens. We get down to the nitty gritty of, it may not be the law, it may be policy. And if we're in one institution, it may be how one group and one facility handles it, or if it's two different ones, they just might decide, this is the way we're handling this. The way you can bet on the law is that the agent controls here. It's not the doctor, it's the agent. If the agent says, this is what I've talked to my person, hopefully, this is what that person wants me to represent and advocate for them, then it's the agent who directs the care. So I'm not sure how the physicians got into a question about it, but I'd be happy to talk to people offline about that if I can.
Great, thank you, Ellen. We also had another one that was, people get confused about having a healthcare proxy and a do not resuscitate and personal directives if they don't agree which is honored by medical professionals.
Okay, so it's a good question about all these documents. As I say, it's not easy they don't work together seamlessly in Massachusetts, hopefully someday. So I would go back to the healthcare proxy. That's a legal document, okay? So that's going to control in terms of the agent making decisions. Now, if somebody has an agent, and that's why this is so separate, that's the decision maker. If the person cannot speak for themselves, they've appointed a decision maker who then talks to the doctor about the DNR and about the MOLST form. So now it's the agent and that clinician who then talk about if a DNR is something that they want to put in place, or a MOLST form decision is going to get made. And it's between those two people that it works. And then the personal directive is just a personal document, right? You have to look at it as that's the way the court would look at that is that's evidence. That's evidence of what that person said they wanted. And again, the agent should be standing up and saying, here's the personal directive, here's what my person wanted, they wrote it down, and so we're going to honor this. And if that means that it's medically indicated for somebody that the doctor is saying, given where this person is, a DNR might be indicated for them, it's still the healthcare agent who has to say, is that what my person would have wanted? Is it in that personal directive? Was it in the conversations that we had? Or am I making this decision if I don't know? This is how the law works. If the agent says, look, I do know this because it's right here in the personal directive, and so I'm going to act on what my person wanted. But if we don't know as an agent, because we can't know everything, and maybe we didn't talk about this specific circumstance, then the agent makes a decision in line with the clinician on the best interest of the person. And that's how the law works for the agent. Now, did I come close to answering that question?
Thank you. We do have a couple more.
Sure.
We have one that is asking about getting these documents in alternate languages. We work with multiple cultures, including Nepali, Cambodian, and Laotian.
Yep.
We have approached these topics. However, there are multiple cultural barriers.
Yep.
Is it possible to get these documents in those languages?
Well, anything's possible. It all comes down to cost. What I would want to, whoever this is, I would love to talk to you offline. We have money to, grant money to expand the documents. What we do is we go to our expert translators and we say, how do we translate into this language? Sometimes it's it's a spoken language, and what we're told is that there is one document that we may already have that gets used, and sometimes not. So would you do me the great favor of sending me an email? My email's, Molly can give it to you, but it's also just on the end of this website. And send me those languages and let me go to my translate people and see if we can make documents.
Great, thank you, Ellen. I'll connect you with Angelica as well.
Thank you.
Last question that we have in the chat at the moment is, do you have recommendations for those people that don't have someone for a healthcare proxy? What are the options?
Yeah, tough question, right? What are the options? So we don't have a pool of healthcare agents, just like we don't have a pool of guardians just yet. I think what the ambassadors are doing very successfully is when someone say, look, I just don't have someone to appoint, or there's too many people in my family and I don't know who to appoint, either one, we get either one, is that we take the time to explore it. And this is in your toolkit. We say, well, let's think about your everyday life. Is there a neighbor? Is there a religious person, a faith-based person? Is there someone at the Council on Aging? As we go back to Council on Aging and we do this work, we find people start buddying up because a lot of people don't have agents and they're able to help each other with these documents. If there's truly nobody you can identify, there isn't a pool I can offer you of people who are agents, but the best thing to do is to go to the personal directive. Now, here's what we're learning about the personal directive, is sometimes when we start with that and people start to understand their own decisions about what they want for care and what's important to them, they can think of an agent. And this actually has happened quite a few times, especially because people have others in their life sometimes that may be able to step in to do it. So I'd say explore it as an ambassador, just explore where they are. And if not, just make sure they do that personal directive, and anything you can do to get that personal directive in the medical record so their doctor knows what they want for care. That's the key, right? It's great to have an advocate, but you also want the doctor to know, their primary care person, what they need for care. I think that's the best we can do.
Thank you, Ellen. That's it for the questions that we have in the chat box at the moment.
Okay, great. Let's move on then. And again, any questions that come up, just send me an email. We are partners. I am happy to answer questions best I can. Wish I had magic wands to have better answers sometimes, but we're working on it. So let's talk about the Serious Illness Conversation Guide. This is just an introduction today. We hope to have, we're working with Ariadne Labs, and some of you may know the name Ariadne Labs. That was started by Dr. Atul Gawande. and they work across a couple of sections of health, but they've developed this really great conversation guide, which is getting vetted actually all over the country. But here it is right here for us in Massachusetts. And all it is a framework for how to have a communication, a best practice. So we noticed that our Getting Started Toolkit and their Serious Illness Guide really worked seamlessly together. So we're introducing this today. Please don't feel like you have to take all of it. This is an opportunity for you to say, oh, I like that question. I like that idea. Let me add it to what I'm doing today. And then if you can, use the whole guide as we go. So you'll have this in your handout. I hope you can see this. The Serious Illness Conversation Guide is that. It's those 7 steps, a step-by-step process. It's a framework for you to use just to set up how you're going to talk to somebody who has a serious illness or maybe at high risk for a serious illness. We'll go through all 7 of those today, and then you can use this guide as you like. So one of the things that we want to do is empower you as nurses and social workers, care managers, and I can't list the amount of things that you do, but you meaningfully interact with folks. It doesn't have to be just the physician or the nurse practitioner or the physician's assistant doing these conversations. You do them every day. We do them in home care and in hospice and across the continuum. So this might help guide you as you go forward. So step 1 that Ariadne Labs suggests is just setting up this conversation. That you know how important building trust is to help the patient feel more in control. So one of the first questions that you can use is, I'd like to talk to you about what's ahead with your illness, and do some thinking in advance about what's important to you so that I can make sure we're going to get you the care that you want. I mean, that's an open, and that I think puts people at ease right away about what's this about. Well, a really important tool is to ask permission. Our ambassadors do this a lot, as well as stopping in that guide and saying, is this okay? Do you want to hear more? And just giving people that control. And then just giving them a sense of the introducing the benefits here about the goal of all of these conversations is so that I have the information about what matters most to you so I can get you the care. That's really what this is about. And we also want to support family if that's in the picture. So just that setup, I'm sure some of you have a sense of this, but this is one way to do it. And then assessing illness, understanding, and information preferences, just like the Honoring Choices tools in our discussion guides, that idea of what is it you understand now about your illness? What do you know about it? How are you feeling right now? And to get a sense of what people know and how realistic the patient is or the person is, this is patient-based language here, about their own prognosis. And this also mirrors our guides about what's your understanding. And this seems to be, however you want to say this, what do you know, how you feeling today, what have you learned about your illness, is it changing for you since what you learned, and how much information would you like from me? Again, that's really been a very interesting, again, that empowerment question. I'm not going to dump a lot of information on you. Just tell me what you need to know today. And if it's not something you can answer, then I think one of the things you can do, of course, like we do all the time, is to bridge them to the next person, right, to where they can get that answer. So assessing illness, understanding information from their point of view is the first part. Now this will depend, this prognosis piece will depend on who you are and how you work in your teams. But one of the things you can always do is you can always say, well, that's interesting. This is what you know about your illness. Let me tell you what I know, how I understand where things are. And I would imagine all of you can do some of this. What Ariadne Labs is doing here is giving clinicians 3 different types of way to talk about prognosis. Now, unless you're a physician, you may not, or a nurse practitioner, you may not use number 1. And that's when people say to you, how much time do I have? So we're really seriously ill and they want a time-based diagnosis. My understanding is that even our physicians are backing away from that because we just don't know things like that. But that's one way to give a prognosis. Another way, what we're talking about is the functional prognosis or an unpredictable prognosis, and this might be more useful to you to be able to say, you know, I hope it's not the case, but I'm worried that things are likely going to get more difficult for you. So, and if you have information about their health, that's the time to give it. Or if they say, no, I need more information, maybe you can help connect them to those folks. And the unpredictable diagnosis is it may be difficult to predict what will happen with your disease. Pretty true. Some people live well for a long time, but others get very sick quickly. And then to be able to give more information about their illness. So again, with prognosis, it may be just as simple for you as echoing the step before, which was here's what I as the patient understand about my illness, and then you as the provider saying, well, here's what I know, and here's what, and then see how that conversation goes. So the next step in the guide is they remind people to allow silence to explore emotion. That silence seems to be a very powerful tool. You likely know this in the work that you're doing. Just give people time to process things. You all know as patients, we don't always hear everything the first time. So small doses of information and respond to the emotion by naming it. And again, this has been helping our physicians who may not have been trained in a lot of this understand to take the time to do that. You're free to borrow any of these statements, incorporate them into your work, of course. The next step in that guide this is actually, I think, the most important piece, is to explore people's goals and their fears. Understanding patient goals helps restore a sense of that empowerment. So what are your most important goals? Like if right now with your health, or if it gets worse, what's important to you? What do you want us to know about your health? What are your biggest fears? What are you most worried about? That question, time and time again, what are you worried about, seems to be really illuminating. Just to be able to say it, you know, and right now I'm afraid of COVID. I'm afraid to go out. I'm afraid to, know what this is going to mean for my diagnosis. And then again, depending on what your job is and what your role is, this can be useful to you. It also, so this information guides decisions and care planning, and also indicates to the patient that there may be some difficult choices ahead. So you're starting to explore down the road now. So what situations are so bad that you can't imagine living in that situation? What's that impossible thing for you? You to understand where people are. I may not be able to breathe well. I may need to have a vent. I may not be able to talk to my family. Whatever it is, it helps to discuss that. And if you become sicker, how much are you willing to go through for the possibility of gaining more time? This is the trade-off question that, again, is done often by our physicians and nurse practitioners. But certainly, if you can go there if you have a patient and a relationship in that, and a client in that situation. And how much does your family know about your priorities and wishes? One of the things the ambassadors do, especially in the early stages of a healthcare proxy and a personal directive, is to bring in the family, is to get them on the phone, is to do it all together. And whoever's the agent, people understand the agent's job and what other family members, how they can participate in this. It seems to be really useful. We close the conversation. You've probably done this many times, but here's some suggestions of, here's what I've heard you say. I've heard you say that blank is really important. And if you want, and if it's appropriate in your job focus, to make a recommendation based on what people said, well, here's what you said. Here's what it looks like our next steps are. Here's what I might recommend. And to make a plan with them and affirm that you'll do everything that you can to help them through this. Those are the recommendations of this framework. And then lastly, document these conversations. So we want to document them in the EMR if you can, but you can always document them here, especially as ambassadors, right? Now this is a great time to check. Do we have that proxy? And even if people say, oh yeah, I got it, see if you can work around, where is it? Do you have a copy? Have you looked at it in the last 6 months? Is that the person you want, and is that their phone number? to be able to reach you. Are you sure your doctor has a copy? Doesn't hurt to send another one to the primary care office. And the personal directive, of course, we'd love people to work through that. So let me stop there, and that's pretty much at the end of those two toolkits to try to, you see that some of the suggestions really overlap between the Honoring Choices tools and the Ariadne Lab tools. Are there questions about that toolkit or just how to have these conversations? Molly, I'll leave it to you.
We don't have anything in the chat box at the moment.
Okay, great. Well, I hope that's useful and you have those toolkits. I would suggest, just take your time with them. Take a look at them. That's just an introduction. I know it's a lot right now. But we will, if you want, offer a separate training just on those tools and go much more into depth to try to help you. So the last thing in just following up here is how are you going to use this? How can this be useful to you in your everyday implementation? Here's what we suggest. See if this works for you. Make a list. Who do you know, and if you haven't already, that is maybe in a high-risk category here, or frail, or may become seriously ill, especially if a COVID diagnosis is going to happen. But give them a call and say, simply, do you have a healthcare agent? I just want to check in on you, see how you're doing. I want to make sure that we have that healthcare agent, we have that healthcare proxy, and if you can't do that, that's fine. Let's make sure we do that personal directive together. And then you can take the conversation from there. I can tell you that many of our partners did this in the height of COVID, and it was most appreciated by families and by caregivers, by agents and guardians. I just want to ask all of you if you have ideas about implementation here or how we can make this easier for you to use. Molly and Lisa?
We did get a comment that on how much are you willing to go through the question. They say it's a great question. Bruce thinks it's a great question.
Yeah, great, good, yeah. And if you're comfortable with that, it is a wonderful question because it gets to the heart of things, and you get to understand more of what people are thinking about. So, yeah. Any other thoughts about implementation from Lisa or Molly? How we can? Is it feasible for people to make calls and see where people are?
Yes, I think. Sorry, Lisa, go ahead.
I was going to say, it's, we have a pretty diverse group on this call today. So I think it really just depends on, the person's role and what, how they're interacting with the consumer, client, patients.
Sure.
So I think it really varies depending upon their role. That was kind of my take, but I think this is helpful information because I do think people interact with families in different levels. And so understanding kind of the options and how to navigate the system for them is, I think, helpful depending upon, where they're interacting.
Yeah, absolutely, Lisa. It's a great comment. This is just, I'm hoping it's as useful as it can be in your role and during this time period. But what we found our partners say is they put the toolkits right on their desktop, and if they put you can also put the multilingual tools on your desktop to just quickly be able to send people the healthcare proxy or personal directive that's most useful for them. Okay, and that's pretty much it, folks. If you want to be a healthcare planning ambassador, you certainly can right now, because you now have enough information. We just would say to you, use the toolkit. There's a lot in it. There's a lot of information in that kit. And as I said, it's all you got to know is what's in that kit. If it's outside of the kit, then we're into where we need to get either legal help or more medical information. We want you to be comfortable with the role. And if you want to sign up, Molly will get that in the survey, and then we'll send you much more information online as we go forward. And here's our last slide. That's where you can find everything on the website. If you want to look more for the serious illness guides, there's that website as well. And thank you so much for listening. remember, we're partners. You have a question, just send it right over to me. And I'm do my best to answer. We'd love for all of you who are not community partners to really consider that, and we'll send you that information as well.
Great. Thank you so much, Ellen. This is Lisa again from Mass Home Care. Just going to close out, and Molly just, oh, sorry. I guess I'm breaking up a little bit. I don't know if you can hear me. Molly, do you want to just go through the CEU again process for people? I know a lot of people would want to just understand that before they.
Yes, of course. So we've taken down the names of everybody that's attended today, and later on today, you'll be receiving the survey with the evaluation and the information that Ellen had just discussed in an email. The first two questions of that survey, if you'd like to qualify for the CEU, are mandatory. That information gets sent directly to Mass Home Care. And then just give a bit of time so we can go through all of the names, and we will be sending you a certificate in the through email. So it'll be the first two questions of the survey that are mandatory to answer to receive the CEUs for this training.
Great. And if I can just add that, I just need to know who wants to be an ambassador so that I can then send you the next step. Because if I don't, all I need is your email. So we'll get that through Molly and Lisa.
Yes,
Great.
I'll send that all to you, Ellen.
Great. Well, thank you all. Wonderful job, really informative presentation. Appreciated your time and your expertise. And thank you to everyone who joined us today. I know it's, been trying times for all of us in the elder care space. I want to thank you all for your commitment and for all that you do every day to care for people as they age in our communities. And again, thank you, Ellen, for taking the time to review information to move for us. Thank you to Molly for all the backdoor behind the scenes work you did to make this happen. Really appreciate that as well. So thank you to everyone and have a good day.
Thanks, everyone.